In recent years, the carnivore diet has gained increasing attention as a potential therapy for inflammatory bowel diseases, such as Crohn's disease and ulcerative colitis. But what exactly is behind it? Can the elimination of plant-based foods really lead to relief from these burdensome conditions? Let's start with some background information. Inflammatory bowel diseases affect millions of people worldwide and can lead to chronic, often painful complaints. Common treatments include medications aimed at reducing inflammation, as well as surgical interventions. But what if there were a way to alleviate symptoms solely through diet? A recently published case study sheds new light on the possible treatment of chronic bowel diseases. In this study, 10 patients diagnosed with either ulcerative colitis or Crohn's disease were placed on a carnivore diet, a diet consisting exclusively of animal products such as meat, eggs, and animal fats. However, before we delve into the fascinating results, it is worth taking a closer look at these two conditions and understanding their differences. Ulcerative colitis is mostly limited to the colon, specifically the rectum, and leads to a continuous inflammation of the mucous membrane. This inflammation often manifests in symptoms such as bloody diarrhea, intense abdominal pain, and cramping discomfort. A characteristic of this disease is its relapsing course. Phases of severe symptoms are interrupted by symptom-free intervals. Crohn's disease, on the other hand, presents a far more complex challenge, as theoretically any section of the digestive tract can be affected, from the mouth to the anus. However, the transition between the small and large intestine is particularly often involved. Unlike ulcerative colitis, the inflamed areas here are not continuous but occur in various separate sections. Additionally, the inflammation in Crohn's disease penetrates deeper and can cause fistulas, unnatural connections between sections of the intestine, or abscesses. Scar tissue can further narrow the intestine, leading to significant discomfort. Typical symptoms include abdominal pain, persistent diarrhea, weight loss, and fever. Despite these differences, both conditions share one commonality. They are chronic inflammations that are difficult for many patients to manage. Surprisingly, all patients who were switched to a carnivore diet in the study reported a significant improvement in their symptoms, with some even able to completely discontinue their medications. These results offer hope for many affected individuals. How can this be? Science suggests that there are several mechanisms that could play a role. First, a ketogenic diet, such as that of the carnivore diet, drastically reduces carbohydrate intake. This can stabilize weight and avoid fluctuations in blood sugar levels, which could dampen inflammatory processes in the body overall, including in the gut. Second, the diet acts as an elimination diet, meaning it removes potentially inflammatory foods, such as sugar or highly processed foods, from the diet, which could give the gut a break. And third, switching to fat as the primary energy source ensures that the body produces ketones, which have anti-inflammatory properties. An interesting observation from the study is that people with inflammatory bowel disease tend to have lower ketone levels in the gut, which is associated with more severe symptoms. But what about the risks? One of the biggest concerns with this diet is cholesterol levels. Some of the patients in the study showed a significant increase in their LDL cholesterol, which could increase the risk of cardiovascular diseases in the long term. Although this increase was accompanied by an overall better health status and reduced inflammation levels in many patients, this remains a point that requires further research. So is there reason for hope? The case study suggests that for some people with inflammatory bowel disease, a carnivore diet, or perhaps more accurately, a ketogenic diet, may be a promising alternative, especially for those who do not get the results they want from conventional therapies. But as with any drastic dietary change, it is essential to work closely with a doctor and closely monitor health changes. While the results from this small group of patients are encouraging, they should be viewed with a healthy dose of caution. With only 10 participants, the study provides valuable insight, but cannot draw strong, generalizable conclusions. Such a small sample size severely limits the power and makes it difficult to generalize the results to a wider population. Therefore, larger, controlled studies are urgently needed to fully explore the long-term effects and safety of this diet. Finally, it is not possible to say with certainty whether the carnivore diet alone represents new hope for people with inflammatory bowel disease. Rather, it may be the low-carb ketogenic diet in general that leads to the improvement in symptoms, not necessarily the exclusive focus on animal products. Both diets significantly reduce carbohydrate intake, which could explain the positive effects observed. However, nothing is set in stone, and as is often the case, it requires more extensive research to draw solid conclusions. It is also important to note that this diet will not be suitable for everyone. In order to truly understand the connections and use them effectively, it is crucial to rely on solid scientific research and clinical studies. Of course, there is also the option of trying different diets at your own risk. However, it is important to always listen carefully to your body's signals. It is best to have your own doctor on hand, especially if you have already diagnosed diseases. That's it for today's episode. You can find the link to the study presented in the video description as usual. If you enjoyed this episode, please subscribe to our channel and don't forget to activate the notification bell. Feel free to share the video with friends. We wish you a long, healthy, and happy life. Until next time.